Good evening and welcome all you new EMS educators out there. I'd like to welcome you to this small lecture that we're going to have today on a few little tidbits that I think may help you or benefit you in your endeavors as an educator. So let's jump right in and let's get started. The first thing I want to discuss with you tonight is learning outcomes and instructional goals. All right, what are outcomes? Where do they come from? Why do they exist? We all consider them to be objectives. All of us have taken a course, and we've seen at the beginning of the chapter, at the beginning of the PowerPoints, the objectives. Those are the things that are set forth by a national standard, whether it's DOT, National Highway Traffic Safety Administration. They say on a national level, every EMT or paramedic needs to know these objectives to successfully complete this course. An instructional goal is something that you expect. And usually those are based on things that you experience in your career or you may have been taught by your instructor when you went through EMT or paramedic class. The difference is one is achieved because you have to know, hey, what these objectives are. And in speaking with that, I would encourage your students, especially your adult learners, to read the objectives prior to reading the content, because a lot of them have been in a school for a while. They may not remember how to study, and a lot of them don't know, what am I supposed to learn, what am I supposed to study, and this gives them objectives and guidelines that say, hey, you should know this at the end when you read the chapter, and then come back and you answer these questions. If you can't, then you may need to go back into the stuff and read. Your goals are, how do I see my students at the end of this class? What do I want my students to be able to do and be good at so that they can go out into the field and treat patients? And that's the difference between the two. We need to also have goals and outcomes that assist that student with critical thinking. Critical thinking is a very important thing to have in EMS. When you go to somebody's house that's complaining of chest pain, for example, you need to determine very quickly, is that patient having a heart attack or is that patient just having muscle pain? And that's going to determine your treatment outcome. You know, if you don't teach your students critical thinking, they're just going to go in. We call them protocol pushers. They're just going to go in and they're going to say, all right, this patient's having chest pain. I flipped to the chest pain protocol. They're going to get aspirin, nitro, oxygen, and morphine. Done. That doesn't work in every aspect. That is why they need to be critical thinkers. One acronym I like to use is the THINK acronym. THINK stands for total recall, habit, inquiry, which is examining in depth what's going on, and then new ideas and creativity, different pathways or alternate ways of thinking of something. And last but not least, knowing how one thinks. So the first two, total recall and habit, that's basically, for example, we'll use the sample history acronym. Recalling is reciting sample history until you know it in the back of your hand. And then doing it to the point where it becomes habit, it becomes second nature. Inquiry examines each one of them. What does S mean? You know, signs and symptoms. What does that mean? What is a sign? What is the symptoms? New ideas and creativity, different pathways. So if I have somebody who says I'm having a headache, what does that mean? What path am I going to take in my treatment, in my assessment of that patient? And then new ideas and creativity, problem solving. So when that patient says I have a headache, but I have high cholesterol, I'm on blood thinners, I have atrial fib, these all can lead you down the pathway of that patient maybe having a stroke. And then knowing your thinking. The book talks about metacognitive, which is among or the process of thinking, and they discuss planning, monitoring, and assessing. And then 3, offer your approach on how to meet the goals and outcomes through the use of teaching strategies. We touched on this a little before in the beginning about adult learners. Not everybody's going to be the same. You're going to have millennials that like to use technology. So the first thing I would suggest is plan. Plan accordingly. When you get your student roster and you know the type of students, especially on the first day, you can better understand of what type of learners you may have. Determine the audience and then determine your teaching strategy. And then be flexible. We all remember that, you know, in our course and curriculum, we had guys that were used to pediatrics or good at pediatrics, and we're not so good at cardiology. So in your adult learners, you may do best with student-centered teaching where you can get there, teacher-centered teaching, and you just teach and they learn and they adapt. And then you may have the millennials who neat apps like how to do assessments and things like that. So I hope this helps, and I really appreciate your attention, and have a good evening.